Dehydration is a serious health concern that can have significant consequences for individuals with developmental disabilities. People with these conditions often experience unique challenges that make them more vulnerable to dehydration. As direct care staff, understanding these risks and implementing proactive strategies is essential for maintaining the health and well-being of those in your care. Many people with developmental disabilities may not recognize the signs of thirst or understand when their body needs more fluids. Direct care staff need to be vigilant in monitoring hydration levels and encouraging regular fluid intake. Providing visual cues, like a water bottle or communication board, can help individuals recognize when they are thirsty. Creating an effective hydration routine involves scheduling regular hydration breaks throughout the day rather than waiting for requests, aiming to offer fluids at least every 1 to 2 hours, and pairing fluid intake with daily activities such as medication times, task transitions, or meals. Visual schedules and auditory reminders, like timer alerts, can help both staff and individuals stay on track. For those at higher risk, maintaining simple hydration logs to track fluid intake, including amounts, times, and any refusals, can help identify patterns and ensure adequate hydration. Hydration protocols should also be adjusted for special circumstances, such as hot weather, physical activity, illness, or medications that affect hydration, ensuring all staff consistently follow these guidelines to support overall health. Communication barriers can prevent individuals from indicating thirst, leading to a higher risk of dehydration if their needs are not consistently monitored and met. Nonverbal cues such as increased agitation, restlessness, dry lips, or changes in behavior may signal dehydration, requiring caregivers to be observant and responsive. Establishing a routine for offering fluids at regular intervals rather than waiting for a request can help mitigate this risk. Additionally, using visual supports like picture cards, communication devices, or simple gestures can empower individuals to express their hydration needs more effectively. People with developmental disabilities often face unique challenges when it comes to staying hydrated, with sensory processing differences playing a key role. They may have aversions to certain tastes, textures, or temperatures of water, making drinking difficult. For example, some individuals may be hypersensitive to the feel of a cup or the sensation of swallowing, which can cause distress and lead them to avoid drinking water altogether, increasing their risk of dehydration. Some individuals have specific sensory needs that require adapting approaches to encourage fluid intake. For those who dislike plain water, infusing it with fruits like berries or citrus can add appealing flavors, while herbal teas, served hot or cold, provide another hydrating alternative. Avoiding high-sugar drinks is important, as they can actually worsen dehydration. Some individuals have strong temperature preferences, so experimenting with room temperature, very cold or warm beverages can help find their ideal comfort level. For those with swallowing difficulties or texture sensitivities, thickeners can make drinking safer, and naturally thicker options like smoothies or yogurt-based drinks provide both hydration and nutrition. Additionally, special cups, straws, bottle holders, or other adaptive equipment can promote more independent hydration, and working with occupational therapists can help identify the best tools for each person's needs. Many medications used to treat people with developmental disabilities can have side effects that increase the risk of dehydration, such as reducing fluid retention, suppressing the sensation of thirst, and causing dry mouth. These factors can make individuals more vulnerable to dehydration, requiring caregivers to be especially attentive to their fluid intake and hydration levels. Antipsychotics can disrupt temperature regulation and reduce thirst, increasing the risk of dehydration, making it essential to offer fluids regularly and monitor for signs of heat intolerance. Anticonvulsants may affect fluid balance by increasing sweating or urination, requiring individuals on these medications to consume extra fluids, particularly during physical activity. Diuretics, which intentionally increase urination, necessitate careful tracking of fluid intake and output, as well as monitoring electrolyte levels. and watching for rapid weight loss as a sign of excessive fluid loss. To support individuals on these medications, caregivers should implement frequent hydration breaks, document fluid intake, and consult healthcare providers to establish appropriate hydration goals. People with developmental disabilities often face physical limitations that make it difficult for them to independently access fluids throughout the day, as mobility challenges require them to rely on caregivers to provide water and other drinks when needed. This dependence increases their risk of dehydration if their hydration needs are not consistently met, making it essential for caregivers to remain attentive and proactive in ensuring they receive adequate fluids. Dehydration can present with a range of symptoms, from early warning signs to severe, life-threatening conditions. Initial indicators include dry lips and mouth, decreased urination, darker urine, and headaches, while progressing dehydration may cause increased irritability, confusion, dizziness, fatigue, and sunken eyes. In severe cases, dehydration becomes a medical emergency, marked by a rapid heartbeat, extreme thirst, little or no urination, very dark urine, sunken eyes, and lethargy. Behavioral changes such as unusual agitation, withdrawal, or increased stereotypical behaviors can also signal dehydration. Recognizing these signs early and addressing dehydration promptly is essential to preventing serious health complications. Alternative hydration sources can help boost fluid intake in a more appealing way, especially for those who struggle with drinking plain water. Water-rich foods like watermelon, oranges, and cucumbers, which contain over 90% water, can significantly contribute to daily hydration needs. Smoothies and blended options provide both hydration and nutrition, making them a great choice for individuals with swallowing or texture sensitivities. Clear soups, broths, and light stews offer hydration while providing a different sensory experience than drinking water. Sugar-free gelatin desserts, which are about 95% water, can be a fun and engaging way to increase fluid intake, along with other options like puddings and yogurts that provide both hydration and nourishment. Comprehensive hydration plans are essential for maintaining individuals' health and well-being, requiring a structured approach to development and implementation. The first step is assessing each person's unique hydration needs, considering factors such as communication abilities, sensory preferences, medications, and physical limitations that may impact fluid intake. From there, personalized hydration strategies are developed, including setting specific goals, identifying preferred beverages, and determining any necessary adaptive equipment. Proper staff training is crucial to ensure everyone understands the individual's plan, can recognize signs of dehydration, and follows documentation requirements. Ongoing monitoring and documentation play a key role in tracking fluid intake, observing for dehydration, and evaluating the effectiveness of different approaches. Regularly reviewing and adjusting the plan ensures it continues to meet each person's evolving needs. Since prevention is always better than treatment when it comes to dehydration, staying proactive and attentive can significantly improve quality of life.